Ladies and gentlemen, my name is Peter Okana Kamin Simon, the student from third year, Bachelor of Physiotherapy, third year. So for today's topics, I'm going to talk on osteomyelitis. If I talk about osteomyelitis, I'm going to discuss on infections of the bones. An infection of bones caused by the Staphylococcus aureus. Staphylococcus is the infection which affect the. Sometimes it can be affected the. It affect the medullary cavity, more especially from the distal part of the bone and to the from the proximal distal part of the bone to the distal. So there are two managements which can be done for osteomyelitis. So in osteomyelitis, the infection, let me say there's within the onset hour of the 24 hours, and let me say within the onset hour of 48 hours, and there is after 48 hours. So for Reflex 3, Reflex 2, for this year, they have given me I should discuss. I'm going to discuss on the onset of the disease on within 48 hours. So in 48 hours, the infection, if the child have brought earlier, like it's supposed to have a past yet form an inflammatory process inhaled by the systemic antibiotics. So the treatment consists of the two. It consists of three. One, it consists of the rest. Two, antibiotics. Three, the general patient limit. So let me start from the rest. So how are we going to give in the rest? In the first place, we need to provide the patients with a splint, and then or by traction. So either the patient affected, sometimes you can find out that the the ligament or the capsule which attached to the proximal part of the bone, which can be affected, because now why, because now the medullary cavity and the reduction of inflammation of the inflammation within the onset of the 28 hours, it must affect the patients. But now the second thing I'm going to talk about antibiotics. In antibiotics, there are two antibiotics which can be given to the patient. Yes, cephalosporin and then vancomycin. In appropriate, the dose can be given to the patients, which if referred, these are the drugs which can be given. Why? To reduce the inflammatory results of the patients. Two, to reduce any swelling or any blockage of the blood, or the rupture of the blood, or the infection transfer from the medullary cavity to the medullary to the blood vessel, or starting from the outside part of the muscle to destruction of the bacteria entering the blood within the choices. And these are the most combination which can be given, like a vancomycin and the cephalosporin. And then thirdly, I'm going to talk about in elder children. In elder children, you can give the same medicine, the same medication, which can be combination of cephalosporins and the clavavaccines. These are the antibiotics which can be given after taking blood culture or sensitive or antibiotics. Change that can be specified from the depending upon the culture of the sensitivity or support. So the child is adequately hydrated and intravenous. The response of treatment is evaluated by the frequency assessment of the patients. So this can be after the patient has been affected, we need to take a treatment or any assessment of the patient or a child can be taken. Then thirdly, we are going to take the response on how the patient is responding and how patient care should be given. First of all, I'm going to discuss on the surgical. I'm going to talk on how good line of the tenderness. Sometimes the tendons can be affected, the mass thickness. So the patients respond favorably. However, the fever will start declining in the local inflammatory signs diminish. So as the child improve, the limb immobilize. So the weight bearing is restricted for the from 6 to 8 weeks of the infections. So after 2 weeks, the antibiotic can be administered by the local or oral route of the patients. If the patient does not respond at any diseases, any response favorably within 24 hours, then start the treatment of the surgical improvement. Either the bone marrow is a cut, maybe can be caused by the external and internal fixation of the bone, or either by the screw wearing. This can be done in a patients of the infected with the osteomyelitis. So thank you very much for joining me, for listening for me. back to again, my name is Peter Lukana Kamis Simon, the student from the third year. Thank you.